From WRAL News and the Capital Broadcasting Podcast Network, this is your Coronavirus, North Carolina News Brief for Tuesday, July 7th, 2020. I'm Cliff Baumgartner. Here's the latest from WRAL.com. Today, the Council of State decided not to overturn part of an executive order by Governor Roy Cooper, giving utility customers across North Carolina a few more weeks before their electric or water service can be cut off for non-payment. The executive order expires July 31st, but State Treasurer Dale Folwell wanted to give municipal-owned utilities the power to start collections immediately. Folwell and groups that represent local governments say the 4-month hold on service cutoffs has left many local utilities in the red. They say even people who haven't been financially hurt by the coronavirus pandemic have not been paying their bills. Cooper said he doesn't plan to extend the executive order past its expiration. The order waives only late fees and penalties, and utilities are already working with customers on payment plans to catch up. Folwell contends there's no way people will be able to make up 4 months of missed payments, but the other members of the Council of State sided with Cooper, so the order stays in place for now. Still, they urged the governor to issue guidelines for resuming regular billing at the end of the month. They're also calling on the U.S. Senate to approve another pandemic relief package to provide help for strained city and county budgets. The federal government will pay vaccine maker Novavax $1.6 billion to expedite the development of 100 million doses of a coronavirus vaccine by the beginning of next year. The deal is the largest the Trump administration has made so far as part of Operation Warp Speed, the sprawling federal effort to make coronavirus vaccines and treatments available to the American public as quickly as possible. In doing so, the government has placed a significant bet on Novavax, a company based in Maryland that has never brought a product to market. In an interview Sunday, Novavax's president and chief executive Stanley C. Irk initially said he was not sure where in the government the $1.6 billion was coming from. A Novavax spokeswoman later said the money was coming from a, quote, collaboration between the Department of Health and Human Services and the Defense Department. Novavax began early-stage safety trials in Australia in May, and the company said it expects to make the results available this month. It said it planned to begin so-called Phase 3 efficacy trials by the fall of this year and could release interim data by the end of 2020. There is no vaccine for the coronavirus, and many clinical trials fail when vaccines turn out to be ineffective or to cause serious side effects. Until now, new vaccines have taken years to develop, and many experts have said the aggressive timelines set by companies and government officials for a coronavirus vaccine are overly optimistic. Irk said more than one vaccine will need to succeed in order to vaccinate the entire world. After an outbreak in a single housing unit of the North Carolina Correctional Institution for Women in Raleigh found 45 people who tested positive for coronavirus, the institution plans to test all inmates over the next week. A few inmates in one housing unit were showing symptoms last week, according to the North Carolina Department of Public Safety, and all 227 women housed there were tested over the weekend. The 45 who tested positive have been separated and placed in medical isolation, while those who tested negative but were potentially exposed to the virus were placed under medical quarantine with close observation and twice-daily temperature checks. Earlier this spring, around 90 offenders in a different housing unit at the prison tested positive for the virus. Since the pandemic began, a total of 877 of the 31,500 offenders in state prisons have tested positive, and a total of 764 are presumed recovered. DPS is in the middle of an effort to test all inmates in state prisons for the virus. And lastly, if you're worried about the risks of going out in public during the pandemic, the Texas Medical Association has released a chart ranking everyday activities based on their risk for viral spread. The chart rates 37 everyday activities, such as pumping gas or sitting in a doctor's waiting room, and local medical experts support the findings. Health officials say, in general, indoor activities like going to the gym tend to be riskier than outdoor ones, and the fewer people involved, the better. The chart rates activities from 1 to 9. The higher the number, the greater the risk. Activities like grocery shopping and eating at an outside restaurant are on the low-risk side, while going to the beach or traveling by plane pose a moderate risk. But the riskiest activity overall? Going to a crowded bar. All of the ratings assume people are wearing masks, washing their hands, and practicing the recommended social distance of 6 feet or more. You can find a link to the full print-ready chart on our website. This has been your Coronavirus North Carolina News Brief for Tuesday, July 7th, 2020. If you like the information and resources you get from this show, let us know. Leave a rating and review wherever it is you listen. Plus, while you're there, don't forget to subscribe so you don't miss our new episodes. Thanks for listening.